Welcome to Ensuring Your Infrastructure Can Support a Remote Workforce, Telemedicine, and Dramatically Increased Patient Load, a Health System CIO Media Inc. production, sponsored by Nutanix. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of Health System CIO, and I'll be your moderator today. We have some audience opportunities for audience participation. You can send in your questions and comments as they occur to you. We'll take them later in the program. We're going to do a little poll later we're looking forward to. I'd like to get you the view that I like, get you into the view that I like. So here's a few settings you might want to adjust. Number one, at the top of your screen there, you have a little view options drop down. Click on side-by-side mode, have that checked off. Then you can slide your screen divider over to the left to make the video boxes larger. And if you see it saying speaker view in the top, that's the view you want to be in. If it says gallery view, click it once and you get in speaker view. Just so you see how we're going to spend our time, first we're going to go about 35 to 40 minutes with our panel discussion featuring Nick Fuchs, Enterprise Architect and Senior Director of IT Infrastructure, Service Delivery and Security with the Springfield Clinic, Tilden Conatser, Senior Infrastructure Architect with Optum, and Cheryl Rodenfels, CTO, the Americas Healthcare with Nutanix. Then we'll have our audience Q&A. So let's jump right in. Nick, I want to start with you. Can you give me an overview of your organization and your role?
Sure. So starting with the role first, kind of in a unique role here, dual threading as a enterprise architect and kind of hands-on senior director over the infrastructure team, our end user service delivery team, and security team here at Springfield Clinic. Springfield Clinic is, I would say, a unique organization. We're about 3,500 staff in about 50 locations across all of Illinois, based out of Springfield. It's a provider-owned and run clinic, and it's not a hospital, which is a clear distinction in this industry. And we have services ranging from primary care to ambulatory surgery to urgent cares to all types of specialty practices, and keeps us on our toes, supporting all those different use cases and trying to find solutions to meet those requirements. So.
Very good, thanks. Tilden?
Yeah, Tilden Conatser, Senior Infrastructure Architect with Optum, formerly DaVita Medical Group. I think we're now the largest ambulatory medical provider in the country, so very large. The Optum part is new to me, so we do also urgent cares as well, but that's
the overview. Okay. All right, very good. Cheryl?
Yeah, hi, Cheryl Rodenfels, CTO of Healthcare for Nutanix. I am a former Nutanix customer while I was the CIO at Presence Health, and my role today is to help our healthcare customers with solutions that improve their organizations, help them save money, and get the innovation and the drive that they need.
All right, excellent. Let's jump right into it. Nick, let me start with you. How has the pandemic affected your organization, and what are some of the things that you've done to deal with it?
Sure. So first and foremost, obviously, the most obvious one is just stress testing that remote capability and swiftly getting a remote workforce that wasn't typically used to working from home or had any policies around working from home or really had tested an infrastructure to support work from home. Thankfully, coming in here, I've only one thing to point out. I've only been here. I was only here about 3.5 months at the start of this pandemic, and I've been here about 5.5 now. But coming in here, and thankfully, we had a project going on to move our EHR system, which involved a major overhaul of our end user computing infrastructure, which from the time I walked in here, that kind of fell on my lap, and having to find a solution from start to finish. And that's where Nutanix came in. We had just rebuilt our entire end user computing platform, all of our desktop imaging, all of our remote capability. We had just refreshed that entire infrastructure, which if we hadn't, to be honest with you, we wouldn't have been able to really be able to support this the stress of getting almost 500-600 support staff working from home. So that piece of it really helped out, having to do a EHR migration. And then I think from a business perspective or a clinical perspective, we saw a huge drop in patient care in terms of people wanting to come, and being that we're not a hospital, we saw about 85 to 90% drop in patient visits during a month period there. So there was a big push from the provider staff saying, how do we keep up patient care? How do we get these patients in here that are critical patients? They had stopped elective surgery, and that's where a telehealth platform came into play. And finding a solution for a telehealth platform was a major drive. And there was a telehealth project in place that was going on for about 6 to 12 months, which had no clear set direction. And it was kind of not a priority, but we always laugh because there's this meme going around that says, who led the digital transformation of your company? And it's like CEO, CTO, CIO, and then it's COVID-19, and there's a big check mark next to COVID-19. So, so I would say, the answer the question, it's really, other than, the challenge and the human challenges of the situation, I would say it's really transformed our organization, pushed us forward into the future in terms of supporting, getting remote work policies in place, advancing our, work from home culture, getting telehealth projects, advancing our technology. It's really been, a tremendous push forward. And I think it really shined the light on the value of technology and IT in our day-to-day, day-to-day going about how we do our jobs in the clinical space. So.
Right. So as we're down 85%. We want to be able to care for these patients. We also want to be able to stay in business, which means we need to be able to do it kills two birds with one stone, so to speak. You can take care of your patients and stay in business. That all became billable, right, with the relaxations on telehealth and all that. So now it's Nick and IT team set us up to do this. But then there's the part of actually getting the patients to be comfortable with it and all that. Sure. But is that sort of what the conversation was like? Nick, make this happen. We need for this to work.
Yeah. It's like the conversation was, we need a platform now. How do we keep our team operational, right? How do we have our essential workers and our essential support teams and HR and all the other pieces that are involved in keeping the organization running? How do we get that done? And then the second part of that is, how do we continue to see patients? We need to find a solution now, and it needs to be operational, and we need to have everyone onboarded in 2 to 3 weeks. And mind you, this is a probably 6 to 12 month project, and we banded together with the team and put in crazy amount of effort and hours. And we not only did we get I think it was upwards of 500 to 600 employees working from home over the course of 2 weeks. We also were able to stand up a telehealth platform from scratch, essentially, using a multitude of technologies, building some in-house portals and invite systems around that. Really was a tremendous uplift, and we met the demands of the business. I think our team here has been super appreciative of that, and really acknowledging the effort that's been put in by the entire IT team here. So.
And you're saying if you didn't have that foundation, in this case provided by Nutanix, you would not have been able to layer on these things on top?
100%. I mean, I think, I reached out to David Kramer, who's our account rep, just thanking him for helping us get this in here in such a quick amount of time. And that's a whole nother story about how we kind of transformed. There's another crazy timeline how we transformed our kind of our virtual computing and user computing environment in another 6 month project in 6 weeks, essentially, in between getting from end to end, standing up an entire enterprise and user computing environment in 6 weeks to support this EHR migration. It just happened the situation had played out, and we built it scalable enough and flexible enough to support an influx of remote workers. So.
All right, very good, very good. Next question, I'm going to go start with Tilden on this. Many of the things that Nick talked about that health systems have done to deal with COVID-19 involve extending the enterprise, and that involves both allowing people to work remotely but also treating patients remotely, and that requires, as he said, network and bandwidth capacity. How much is enough, and what is the fastest and most affordable way to get more?
How much is enough bandwidth for network? There's never enough, I think. Yeah, we saw a lot of strain on that, obviously, with VPN and people moving remote, and we were lucky to have a pair of VPN concentrators that we were not in production that we could add on to. But yeah, there was a huge strain on the network, for our biggest markets as well as our smallest ones. So it had a big impact. But yeah, I mean, I don't know if there's a perfect answer for that one, but I think, the fastest, most affordable way to get more, I'm stumbling on this one, sorry.
All right, let's have Cheryl bail you out. Cheryl?
I'll help you out. One of the things that we saw, and this goes to what Nick was saying too, about they stood up their telehealth real quickly. They probably hadn't had bandwidth or were thinking about that, because that is a big bandwidth use. But one of the things that we've seen our customers do, first things first, instead of having all those services that come through you control the internet access and going back out, is stripping out the things that could go directly to the internet or to the cloud, because all of a sudden you're not managing that traffic. So whether it's split tunneling, what it really allows you to do is free up things, but hospitals like to be in control of that. And so that's something you can do pretty much without any money. The next thing is really managing your workloads. And that's one of the things about a Nutanix environment, is you can take a look at your workloads and prioritize who gets the access, right? So if you have some lesser applications that may not be as important right now, let's go ahead and focus on expanding the capabilities of the ones that do, especially because you can manage and monitor whether you need more storage or less storage, you need more compute or less compute. So I always recommend looking at what you have and reducing the priority on the things that just may not be as important right now, because you do have priorities. If it was getting telehealth out, if it was getting more space for VDI, you have to have that flexibility to meet those needs. And, as Nick said, you had to go fast. So I think that's where your engineering and your architect brain comes in and says, okay, how can we rearrange this? Now, once we do that, we can add back capacity through regular channels of ordering or provisioning to revamp and re-add those services that are, again, less priority.
Yeah. Anthony, I'd like to just add,
there, Cheryl.
I'd like to just add to that a little bit too. I mean, I think you hit on something really, really important there, is just understanding your workloads, right? Understanding the workloads on where, what your requirements are. And I think the answer to this question is just, it varies so much based on that organization, the workloads. Are people doing Teams collaboration software over a VPN? Are they installing the Teams app directly from their home workstations, which I think you said from your splitting that out, making them, if you're hitting bandwidth capacity capabilities, splitting that out so they're running the Teams client directly from their home workstation or directly through their own personal internet circuit, things like that. And the most affordable way to get more too is, just to add something there, from our perspective, is building deeper partnerships with vendors. And this is just more than just a network and bandwidth capacity piece. There's been so much support from the technical partnerships that we've had with a lot of technology companies, just jumping into, hey, we'll up your bandwidth, or we'll or we'll give you more licensing for this, that, the other thing, just to support you for 90 days. And that's been an eye-opening experience for me from just the support that these vendors came out of the woodwork that I hadn't even had any interactions with yet, that didn't have a relationship with, saying, hey, what can we do to help? And I think Nutanix has been one of those. They sent us a 200 masks, N95 masks with some kits, and just having those partnerships come through. And I don't want to digress off topic here, but just building those partnerships have been huge for us in supporting us, in supporting us in any way they possibly can. And how do you get that quickly and affordably is just, those building those strong partnerships, and having good partners support your organization is key. So,
Nick, I just want to ask you something. There's been a lot on social media about this from IT executives. So, they talk about their, vendors that have done it right. And there's a lot of complaints out there about vendors that have been aggressive from a sales point of view with IT executives at this time. Almost a hypersensitivity among folks in your position.
Sure.
People talking about making lists and remembering the names and all this. Where do you come down on that whole thing about how you want vendors to approach you and interact with you? Obviously, Nutanix has done it well. Have you seen it done wrong recently?
Yeah, I mean, it's always going to be a mixed bag there. And you got to keep into account. I've been on the vendor side of it, so it's a struggle to get those communications out there, and you're trying to find creative ways to reach out, and really engage someone and get them looped into your service and see the value of your service. So there's always a challenge there in communicating, and it does get frustration because there is a lack of sensitivity to the subject and lack of understanding and awareness of what these IT organizations are going through. Some of these IT organizations are being furloughed and being cut. And last thing you want is someone, flooding your inbox with, hey, buy this service, check this out. And I think the recommendation I would make is just to understand the sensitivity of the situation, understand, try to have some self-awareness of how you might be coming off to someone in, the range of situations that could be possible outcomes of how COVID-19 has impacted an organization at this point in time.
Good points.
So I would just factor it in. And I think taking a humanitarian approach like Nutanix did and building, finding this as an opportunity to actually genuinely help, it's going to build a stronger partnership in the future. And it's an opportunity to enhance your relationship with the organization and drive future business through just genuine support. And I think that's, what's been impressive with Nutanix, with Microsoft. We've had Avaya and our Windstream vendor come in and say, hey, we got you on 90-day soft phone licenses. There's no cost associated with that. We're going to cover you. Just things like that to help get our remote workforce going and keep our operation running has been, I mean, I can't say enough good things, about that kind of support. And that's just going to build us, strengthen that relationship moving forward. So that would be my recommendation. So
appreciate you addressing that. Next question. And let's go with Cheryl on this. Let's start out with Cheryl. What does it take to move non-IT and non-laptop users home? Many times, my house, the kids are on, some remote stuff to teleteaching, so there can be family computers and adequate bandwidth. So your thoughts there, Cheryl?
So this is one of the things when asked, what are some of the challenges we look at? A lot of hospitals, your IT staff might have laptops and some of your administrators, but most of the staff, you've gone to either small form factor PCs or thin clients, because if you're not in IT, most of the other employees in your organization come in, they're knowledge workers, they do their work and they go home, and they have, consumer appropriate IT at home. They might have a laptop or a desktop that they share, like you said, Anthony, with 3 kids and a hamster, and you have bandwidth that's appropriate for watching cable or streaming Netflix, but they don't have IT grade services. So a lot of organizations have had to hurry up and figure out what can we do quickly. And it really is a different approach. Nick had mentioned it, and I know Tilden has gone through this, where what devices can we get in their hands while we maintain our security, but we make it easy for them So getting them, again, can they take their equipment from home, knowing that if they have Epic or Meditech, that when they put the devices back, whenever they come back to work, all the printer mapping has to be right. And I think the other thing that folks have had to deal with is remote access sometimes doesn't look like it does while you're at the office. And they're not IT staff. So they're trying to figure out what buttons do I have to push to make this work. So a lot of the vendors have done some really great things. We have a desktop as a service product called Frame, and you can spin up a desktop pretty quickly as a web service so that you don't have to have it on a physical computer. But really working with your partners to do some creative things where can you work through just your office products that are online? Can you do the web version of it? And I think the other thing is getting quick access to either dropping a VPN client on a home computer or getting folks inexpensive small form factor PCs and monitors and things they can take home. I know both Nick and Tilden had talked about getting soft phones and these other things. So quickly, you have to figure out what are your requirements, bandwidth, access, do I need a computer, do I need a monitor, and then really packaging it up and getting it out there. And then I think probably the most creative thing I've heard is working with somebody like Best Buy or Fry's or Amazon to create a SKU that says, this is our work from home SKU, order it and it will be delivered, because people were just trying to get the equipment there as fast as possible. And especially if they're spread out through a good geographic area, everybody's been really creative, but that's what we've seen. And then people calling to see what access they could increase, even temporarily with their existing home bandwidth.
Yeah, I can definitely talk a little bit.
Go ahead.
Yeah, I can definitely talk a little bit about that. We had a really big struggle on trying to, we have a lot of workers that don't have devices that needed access. And unfortunately, we're in the middle of doing a POC with Frame, so we haven't had it implemented. If we did, it would have been so simple to be able to scale that infrastructure out to provide as many laptops as we wanted quickly, and then not have that bandwidth hit, as we talked about later, where, you know, we see tons of struggle with bandwidth because of, you know, sessions and VPN. What we ended up having to do is really increase an old Citrix environment and do published desktops, which once again put a strain on our infrastructure. It definitely got us through, but it wasn't the most ideal situation where, you know, using Frame and it being up in Azure, it would have a zero impact on our existing bandwidth and would have been able to let us take care of that a lot easier. So it was unfortunate timing, but we're definitely putting it in place. It's a great product.
Nick, anything you want to add?
Yeah, absolutely. I mean, you know, I think Cheryl hit on a lot of it. You know, I think one of the other challenges that was very difficult to navigate was finding hardware, right? And finding hardware and devices and just being able to grab anything that was out there and make it work. We basically we came up with several clever solutions, and, you know, touching on the security piece of it, right? You know, we didn't want to put hardware out there that has you know, potentially patient data on there and give people endpoints to take on their home networks. So we found some clever solutions around using. There's an operating system called Cloud Ready that basically turns it into a Chrome OS device that makes it super secure, and you can install it on any hardware. So in navigating that to give them their web-based access, their web-based infrastructure home, and then supplementing that with some Citrix apps, or even just installing installing a Citrix Remote Desktop VDA on their physical machine in the office to give them that access. Because right now our current processes around how we handle user personalization and settings and application installs is not very mature. We're working through that. It's on our roadmap for the immediate future. But just finding clever solutions around, you know, how to get hardware when everyone in the world needs a webcam and needs a a laptop, and it literally was impossible. So, you know, I think at one point we had 3 separate orders open with Dell for the same equipment, just to see which avenue would get it fastest for us. And just kind of navigating all those challenges, working with our distributors and connections and, you know, all types of vendors, just to kind of find what hardware we can get, and then how do we make that hardware work with the least impact to security and mitigating any risk associated with that. So.
All right, very good, Nick. Let's stick with you right here. What does it take to conduct telehealth and virtual visits? There's a distinction there between having employees, like, so for example, IT employees work from home versus letting physicians conduct a telehealth visit. So you want to break those down a little bit?
Yeah, absolutely. So conducting telehealth visits, I mean, it takes a lot, right? So I can speak to this firsthand of having been in 2-a-day meetings, one at 7 a.m. and one at 5 a.m. For the better part of, you know, 6 weeks now. Just kind of organizing, especially across a big organization, and getting how do we do this? You know, what software what technology do we use to actually get this done? What are the needs? What are the requirements? What do we need from a regulatory and legal perspective, from a teleconsent forms and getting that approval, moving that through the process and understanding that. Thankfully, those regulations and requirements are relaxed during the whole process, which also presents some challenges, because then we've had some providers doing, you know, some of their own, you know, FaceTimes, and it just becomes difficult to maintain that, right? I'm thinking also from an integration perspective, how do you track these visits? How do you record this in your central scheduling tool and your EHR? What does that integration look like? And then also the coordination throughout all of the business side of it, right? How do you know, what are the co-pays look like? What do the reimbursements look like? What are, you know, navigating all of the challenges and complexity there, and getting that in order? And then how do you get this information out from a marketing perspective to your patients? How do you make people aware of this, and just basically, and how do you do it so quickly, right? How do you navigate getting it out there in a rapid manner to support, say, the 90%, 85% reduction in patient visits, and continue seeing and treating those patients and providing that patient care? So I would say it just takes a team. It takes communication. It takes collaboration. It takes, you know, and it just takes grit and grind and blood, sweat, and tears, every, you know, any piece you want to throw at that, and it just takes coming together and understanding the challenge and defining what those requirements are, and then just executing. So.
Cheryl or Tilden, who wants to jump in there?
Sure. You know, one of the things about telehealth visits, the systems that the hospitals install purposefully, thoughtfully, strategically are integrated so that the physicians, it really mirrors the physician or the clinical provider's workflow. So the video pops on, they've got their notes, they're looking at the camera, they don't have to manage all the technology. And what's happened during all of this, and Nick mentioned the collection of things that they had to put together. A lot of organizations are using more than one solution, up to, we talked with a customer 2 days ago that's doing 5 or 6, but it's allowed them to be flexible. So when they go back to, we're going to be in some sort of regular cadence with this, they want the integrated systems, but they also have to have the flexibility for people that have low bandwidth, or in areas where you still only have 3G or lower bandwidth options. So there are some technologies out there where these video systems have created good algorithms that you can get a good video on a 3G network. So that's something to look forward to when they have time to actually test these. And then the other thing just to consider, video conversations are treated just like phone conversations. So it's just a mode of delivering the conversation, and that you can see the person at the other end of the line. But the system part of it is that just as if you're talking to them on the phone, you don't have to record the video conversations. That doesn't become part of the record, and that would drive healthcare organizations crazy because of the amount of data you would have to have. But they're spending more times on again, what Nick mentioned, getting the notes right, making sure that the visit gets recorded, scheduling, and other things. But I think there's going to be some happy median between the really integrated systems and the ones that give them an alternate, plan B technology in case they have lower bandwidth requirements, or they have things that really have to stretch their capabilities.
Tilden, anything you want to add there?
Yeah, and I think one of the things that what I saw our team doing really well that IT, obviously wasn't a direct part of, but we, were able to help them deliver is getting the elder patients comfortable with telemed. A lot of them obviously aren't as technical as, younger people are today. So that was a thing that I saw us do really well as our marketing team putting together information and getting it out to the patients on getting their comfortability up with telemed, since it is kind of intimidating to kind of get up. And I actually had a telemed session, and I'm fairly technical, but it definitely some steps to it.
Yeah, I would say you're fairly technical, Tilden. I think we could say that, right? With confidence.
Yeah.
I want to jump to an audience question because it sort of plays off something Cheryl had just said. So Cheryl, let me read you this question. You could take a first crack at it. One barrier for community health centers to utilize telemedicine is the bandwidth at the patient's location. CHCs mostly serve patients in poor communities and those experiencing homelessness. How would you recommend helping these types of patients to get access to telehealth? Cheryl, why don't you take the first shot at that?
So one of the things that you can draw the parallel to is people that provide home health and hospice, remote situations. Usually the providers go out and they have terrible bandwidth where, maybe they have to take a hotspot with them or something. So there's a couple of options. One, as I had mentioned, looking at those vendors that have the algorithm developed so that they can take advantage of low bandwidth situations. The other thing is setting up stations that are in the community. So for example, at the fire department or at the school, someplace that actually has Wi-Fi that's in the community, they can pretty easily commandeer those folks, or partnering with a business where while people can't make it to the clinic or that would not be as safe, what they can do is take advantage of a place that does have the bandwidth. And I think FQHCs and community health services will find that maybe it's the local mom and pop convenience store or something like that, but people are willing to drive a little bit, and then they don't quite have to worry about the technology. So look at your community. Maybe it's the library. Maybe it's your little your county government seat office. I would take advantage of things that exist instead of having to invent new ones. And it's just driving a little bit different model of the business than is it at my home.
Nick, any thoughts there?
Yeah, I would just add. I mean, I think Cheryl nailed it with her first bullet there too. Is choosing a solution that's taking advantage of those and optimizing for low bandwidth situations. And there's a lot of them out there. There's been some breakthroughs using WebRTC technology where you can do high quality audio and video right in a browser. No applications need to be installed, and that's kind of what we took advantage for our solution. Is found something very simple that works across a lot of use cases. And doesn't take, and just hitting on the point that Tilden mentioned about some elderly staff and things like that. It's very easy to use, right? And people are widely able to use it across any device. You don't have to install anything, and it just works on low bandwidth. It has very low bandwidth requirements and works across really any scenarios. And we have at Springfield Clinic, we support a lot of those rural communities in the area, so where there's a lot of bandwidth constraints and things like that, and the solution is kind of the solution we chose in that regard has really helped out a lot there. So,
Tilden, anything on that?
Yeah, realistically, VDI, right? Something like a frame comes into play there, because then it doesn't matter what, as long as they have a computer that has internet access and can open a browser, you've got a solution right there that's extremely secure and very quick to stand up.
All right, very good. Let's jump on the next audience question. Cheryl, I'm going to pull you out first again on this one. Any thoughts on how long the HIPAA rule relaxation will remain in effect? Any insight on provider organizations' long-term strategy for remote workforce, i.e. will clinical and non-clinical employees return to the office setting quickly, or might the remote worker model, in particular for non-clinical roles, be the long-term approach?
So breaking that down a couple ways, I think HIPAA is going to come to a compromise. Again, part of the ruling is, you don't want somebody doing the Zoom bombing or that sort of thing into somebody's video. But if you guys look at the top corner of your Zoom session here, the second little shield in there, it says your client connection is encrypted. I think we're going to see some more of these technologies that come out of the box encrypted. So that would be one thing. And I think that's part of this for the video visit. And like I said before, the rest of it is a conversation between you and the provider, as long as you're protecting against somebody else listening in. So I think that the HIPAA legislation or the HIPAA ruling is going to be someplace in the middle, not as strict as it was, but it's not going to be, free form either. So people are going to scramble to make sure that they can get the encrypted solutions. And as far as people going back and so forth, this is why I love the ability to surge into cloud-like technology. Is I think we're going to see this go back and forth. There are some jobs that are being done remotely now that would be better served at the office, because truly they still use printing. They might need dual or triple monitors to do their workflows, like billing and coordinating, coding, and some of these things. So I think there is going to be a gradual move for people who can move back to move. I think the other thing is not everybody wants to work at home. They want opportunity to work at home, but how many dogs, dog barks do you have to have? How much? Everybody's played Zoom bingo, where your child runs through and says, "Mommy, can you open this?" and all these things. Those are great, and people put up with that because it's okay, right? Kids don't have daycares to go to right now. Schools are being online. I think it's going to be happy medium. The technology for this has to be able to surge for capacity, and then it has to be able to come back down, which is what cloud technology does, right? You're able to put things where you need more capacity and bring it back. And that's why with our on-premise solutions, you can create that surge capacity, and then you can bring it back down when people are back at home. It also rearranges your resources, and you're going to have to watch the licensing too. Remote licensing is different than on-prem licensing. And so you have to balance all of these things as your organization figures out what do we need to do and what is a good mix of these types of working, and how do we accommodate all of it, but we also have to be able to afford it.
Wow, really good stuff there, Cheryl. Tilden, any thoughts there?
Yeah, I can speak to a success story on telemed that we have. I'm in the Colorado area, and we've got a bunch of clinics in Colorado Springs, and they've been, one of the things that we've seen change is the ability to get decisions made and move forward. And they've been trying to do telemed for 3 years without really success, and then we got it stood up in 2 weeks for them. But I'm also been in a meeting with the chief medical officer for that area, and they're really having a lot of success, and they're actually able to see patients that normally have a hard time getting in to the office. So they're having some real positive aspects come about. And what I think we'll end up seeing is, to Cheryl's point, like a happy medium where there is still quite a bit of telemed going on, and still people coming into the office, because I think people enjoy that communication with the doctor, one-on-one. But I also think for patients that have a hard time being mobile, where telemed is going to be a huge win for those folks.
Nick, anything there?
Yeah, I think Cheryl hit on all the points. Hit on all those points really well. As far as the HIPAA regulation piece, it'll be interesting to see how that plays out. I think especially from our perspective, is we have been really factoring that into our design decisions, because while it seems really like easy to say, hey, let's just jump in and use Zoom or use this or use that, or use all these different tools without kind of digging into, is this HIPAA compliant? It's once you implement something, it's very hard to take it away, right? And as it's very easy for us to meet the demand and the challenges of getting a product out there. Taking it away down the line and changing it, it's very difficult once you've proven it to work and people understand it and providers understand it and patients, it's successful, right? Taking it away to get some more guidelines and regulatory constraints around it, that becomes a challenge. So just walking that line and making sure that we have the ability to tighten it up when those regulatory requirements also tighten up. So that would be the only point that I would just add there. Just making sure you're choosing a solution that can meet those stricter requirements down the line.
All right, let's get our audience poll out there. So go ahead and answer this. At the start of the pandemic, most health systems did not have a strong enough network infrastructure in place to handle all the things they would need it to support. Do you agree with that, or do you disagree with that? Again, did not have a strong enough network infrastructure in place. So go ahead and answer that, and we will let's take another question from the audience. With a potential move to a more robust remote workers model, does the panel feel that this will lead to more offshore outsourcing of healthcare IT roles? Cheryl?
I think this pandemic showed us something that I think the United States was very ready to handle a lot of remote access for US employees because we had good bandwidth options, even if some places weren't optimal. I think some of the places that are outsourcing candidates have less opportunities at their homes for good bandwidth and infrastructure. So I don't see it as a bigger move to work offshore. What I see is with more opportunities to offer remote working in the US and to our own employees, I actually see our workforce opportunities increasing here, because that's one of the things that people really like, is the ability to work from home. But I think I've seen in several cases with several of our customers, their offshore people aren't working right now, but onshore here, we were able to accommodate more people.
All right, very good. I want to let's look at the poll quickly. Let's take a guess. Let's have our panelists guess. This is one of my favorite things here. So, Tilden, what do you think the results are on this poll? Give me a breakdown percentage-wise.
I think the majority would say that did not have.
So they would agree.
Everything.
Majority agree.
Yeah.
You're going to give me a number? Give me a number.
74.
All right, so Tilden's at 74. Cheryl?
I was going 75, but he hit 74. I'm okay with that. 74 could be better.
All right, so you're going 74. So you're with Nick. What do you got?
Is this like The Price is Right, or whoever? Like, what are the rules here?
I haven't thought it out that far, but let's just
let me know. I'm gonna be a. So I would say about I would say probably about 85%. I would say it's probably strongly agree.
Yeah.
Here.
So that's going to be Nick's the winner. It's 81% agree.
Wow.
Nick is the winner, but it was close. It was close. So
Yeah.
Let me just share those results. Okay, let's see if we can bang through a couple of more questions. I'll just have one of you answer each of these. Tilden, I'm going to go with you on this one. What cleanup or revisions have you made or will you make to continue operations once workers return to the facilities?
I'm sorry, could you repeat the first part? I missed that.
What cleanup or revisions have you made or will you make to continue operations once workers return to the facilities?
Well, as far as IT concerned, a lot of cleanup. We've had to extend a lot of old systems, stuff running on 2008 R2. I think there'll be a lot of good changes, but definitely a lot of cleanup in the IT realm of things. I think Nick and Cheryl both mentioned a lot of people have jumped on a lot of different technologies that might not have been the best choice, but maybe the only choice or the easy choice to make just to get through the COVID-19 crisis. So yeah, I think there's going to be a lot of cleanup, a lot of changes, but I think what it will have done and has done in a lot of ways for us is given us a good path forward and understanding what that is going to look like, and once again being able to have those decisions made. And like with Telemed, now it's in place, it's not going to get taken away, so there's going to be some good things like that that'll take place as well.
All right, I want to jump to our Ask a Co-panelists, and I want like Cheryl to go. Cheryl, do you have a question for one or both of your co-panelists?
Yeah, so as we're looking, at business continuation was one thing of how do you get back. When your state started with shelter in place or so forth, did you follow a disaster recovery business continuation plan, or did you just shoot off the cuff?
I'll go ahead and answer that one first. Being new to the organization, and Springfield Clinic has gone through quite a transition over the last few years, from growing from it's been around for 80 years, but it's kind of grown from a mom and pop operation to what it is today, 50, 60 locations without maturing a lot of these enterprise processes. So I think being new to the organization and not having a formalized, agreed upon regular process in place, we've had to kind of shoot from the cuff a little bit. But I think that's shaped the outline of what we need to do for the future, and it's given us a trial run at how we need to execute in these BCP plans and even our disaster recovery plans, and it's shown light on the value, so that when we go to the board and the leaders of the organization, the CEO, and lay out, hey, we need X amount of funds to get us a better BCP infrastructure and a DR infrastructure, and build out our data center and our remote capabilities. There's a mutual understanding of the value of that. It's not like, why do we ever need that? And I think healthcare is very cost conscious, as an industry is very cost conscious. But I think this whole situation is gonna help drive that forward, and the value and understanding of how this all comes into play. So,
Tilden?
Yeah, we're kind of in the same position. So this company has grown through M&A, so there's not been a lot of standardization, and I'm actually in the middle of a project to do consolidation, standardization for all what we call care delivery organizations that are located across the country. So definitely a lot of shooting from the hip, just coming up with stuff as we go. And we're in the middle of creating that business continuity and DR and what that looks like, and that's a huge undertaking. So yeah, we're kind of in the same position as Nick.
Cheryl, we're just about out of time. I want to give you a chance to offer a last word and around this idea, the concept. So the concept is that we don't know where we are in this pandemic, but you get the feeling we might be just over the curve, right? Hopefully, things could come back and all that, but you get the feeling it's possible the worst is over. As an IT leader at a healthcare organization, what's your advice for those folks? Does that affect what they're doing today, the things they're investing in, the plans they're making? You mentioned the concept of invest so you have flexibility, right? Leverage the cloud, and then you'll be ready for anything. So just your thoughts around that before we end our webinar today.
And that's what I was, as you started to talk, Anthony, that's one of the things is you have to be flexible because one size doesn't fit all. While you might have your EHR has all the right capacity because you're switching your visits. Some of these other services like the front end services like VDI, you don't have the capacity. So having technology that is flexible to grow and surge with you, as well as having technology that you can put back to a regular capacity is super important. So I see a couple of things, and whether it's using public cloud, using your on-prem cloud, using software as a service, this whole idea of having a multi-cloud environment allows you to increase where you need to, and you understand the costs associated with it. At the same time, when you reduce services in one area and you can move them to another, it brings your costs back in line with what you're used to with your on-premise technology. So I think that's it. It's being flexible where you can, because I don't think we're quite able to plan for this, but we should be tracking everything that we're doing so that we know that we have capacity for 5,000 visits, virtual visits a week. And we know that we have capacity for 6,000 employees to be working at home. So I think that's really paying attention, understanding how the behavior of an organization changes, what you can afford, and what operating normally also looks like.
Excellent. Well, that's about all we had time for today regarding continuing education. You can use the final slide in this deck for your CEU needs. You'll get an email when the recording of this event is ready for viewing. If you want to sponsor one of our upcoming events or book a custom event, you could reach out to Nancy Wilcox, and you can go to our website to register for our upcoming webinars. With that, I want to thank this great panel, very, very exciting and lively talk. Nick Fuchs, Tilden, Conatser, Cheryl Rodenfels, and I want to thank Nutanix very much for sponsoring this event and making it possible. And I want to thank you, our attendees, for joining. And with that, everybody have a wonderful day. Thank you.